Good evening, everyone, and welcome to our session. I am Dr. Tarinee Puri on behalf of Voice of Healthcare, and I welcome you all to yet another session of Blue Wave of Change, Navigating Colorectal Cancer Awareness Together, supported by Dr. Reddy's Labs. This series aims to raise awareness and provide comprehensive insights into various facets of colorectal cancer. Through a series of engaging panel discussions, we aim to address critical aspects such as early detection and screening strategies, highlighting the importance of timely identification and also discuss common misconceptions and barriers. Today, we will be discussing the tech enhanced support systems for end to end care in colorectal cancer with a focus on patient centric care. And now, I'd like to welcome our esteemed speakers for the day. Dr. Rohit Pai, Consultant, Medical Oncology and Hemato-Oncology, Bombay Hospital and Research Center, Mumbai. Dr. Kaushal Patel, Senior Consultant, Medical Oncology and Hematology, Elite Hemat Onco Care Center, Surat. Good evening, Dr. Patel. Welcome to our session. Dr. Nitish Garg, Assistant Professor, Department Medical Oncology, Dayanand Medical College and Hospital, Ludhiana. Good evening, Dr. Garg. Welcome to our session. Dr. Tarachand Gupta, Senior Consultant, Medical Oncology, Bhagwan Mahaveer Cancer Hospital and Research Center, Jaipur. Good evening, Dr. and welcome to our session. Now, without further ado, we'll start our session. So, my first question is to Dr. Garg. Since we are talking a lot about technology today, so could you elaborate? Could you first explain a little about colorectal cancer, and then could you elaborate how technology can be can be incorporated in different aspects from screening, diagnosing, and even treatment for that matter? Just a brief overview.
Yeah, so if we talk about colorectal cancer, it is at present third most common malignancy in the world. And we have seen the constant rise of cases. Sometimes we tend to miss the early diseases because of some small adenomas which are not picked up on a routine colonoscopic examination. So earlier, the main investigation for colorectal malignancy is colonoscopy plus a biopsy. So, along with that, with the advent of newer technology, with the use of artificial intelligence, what we have gone into is there are something called virtual colonoscopies, where we can use the AI tool and see where are all the doubtful lesions and keep a watch on them. And on top of that, if we take a biopsy, there is also a term called or a thing which is called a virtual pathology or a digital pathology. So we take out the slices and compare it with the database with the use of AI, trying to find out are these pre-malignant or a possible malignant lesion looking like to be favoring a aggressive malignancy or not a aggressive malignancy. Then coming to some genomics where we can find out if it is a non-malignant counterpart, can it be malignant at some point of time? Does it include a driver mutation or something like that? So these are the few places where technology can give us a better role. And on top of that, staging and routine screening evaluations, which have actually been proposed as a part of care. Even in the European countries or the West, the coverage for screening has not gone beyond 60 to 65%, I believe. So, be it in India, the coverage I believe is too less, maybe less than 5%. So, there the role of virtual colonoscopies increase. But again, the AI has started getting incorporated in our system. It is going to take some time, but definitely it is going to help our patients a lot.
Right. Thank you, Dr. Garg. So now building on this, my next question will be to Dr. Gupta. So, as Dr. Garg already mentioned a bit about AI, artificial intelligence in diagnosis, in screening. So, could you also tell us about probably telemedicine and how that could help spread awareness or help us, or another form of technology that could help spread awareness of colorectal cancer in general? Dr. Gupta, I think you're on mute.
Yes, ma'am. Please, can you repeat your question?
Sure. So, as Dr. Garg mentioned, artificial intelligence in diagnosing and screening in India and other countries. So, could you also, and he mentioned that in India it's only 5%. So, could you mention the role of telemedicine and other technologies that might spread awareness or, help in colorectal cancer awareness or even for that people?
Yeah, telemedicine can be helpful in any cancer for at least creating awareness. It is yes for the treatment part it is not possible at present, but yes for awareness it can be done because there are some common symptoms of the colorectal cancers are there. For that, like pain yeah,
Dr. Gupta, I believe there's
constipation. So these are the some symptoms which can create awareness that if the any person in the family is also affected, like mother, father, or grandmother, grandparents, if they are also affected, then also they these people, if these are having symptoms or any genetic history or family history, then they can come to on platform on the telemedicine and can these symptoms be of colorectal cancer. So at that time point, as the previous speaker suggested, that patient can be advised for the some blood tests like CEA and with colonoscopy or sigmoidoscopy, which can detect the early cancer if it is there. So that can be done by the local gastroenterologist. But telemedicine can be helpful in directing the. We should not say the person that we can say the people who are for the screening also. That is called screening purpose. So this can be helpful by the telemedicine only. But yes, now it is not in still use so frequently, and people are also not very aware. So it is it's a challenging task at present, but yes, it can be helpful in guiding to the local physician.
So, as we are talking about telemedicine, would you also like to add a note on the digital schemes of government, or how the digital platforms have kind of improved not only awareness but also, the stigma associated with colorectal cancer? If it has increased the ease at which patients approach doctors and so on.
Yes, digital platform because this is a time of social media or digital platforms. When the people are frequently OTT platforms or searching the social media platform or YouTube channels, from where they can get preliminary knowledge about that, the warning symptoms about the colorectal cancer and the affected hair and how that can be detected. So these platforms are very useful in creating awareness because this is the you can say this is the trend of the day now.
Thank you, Dr. Gupta. Now, my next question would be to Dr. Patel. How do you think that these platforms would help the spread awareness in specifically the rural sector, and how it would improve the reach in terms of accessibility of treatment or even diagnosis? Dr. Patel, could you hear us? All right. I believe Dr. Patel cannot hear us. So, Dr. Pai, would you like to answer this question? Hello, Dr. Pai.
He is muted.
Dr. Pai, you're muted. Can you hear us? I believe even there's some technical. Yeah. Dr. Pai, you're muted. Could you unmute yourself, please? I believe there's some technical error. So, coming back to Dr. Garg, would you like to take up that question? Specifically, how do you think this would enhance the technology, the telemedicine, etc., would enhance the reach in the rural sector?
So definitely telemedicine and with the advent of e-media, the social media, the reach to the general public, it has enhanced and people have become aware of the treatment. And also, initially they used to think that the diagnosis of cancer is probably a death sentence, which has now started to get rid of from their mind, and this myth has busted already, and more and more patients are coming forward to take treatment believing that the disease can still be cured. So that has made a huge difference with the patients and also the family members, so that the suffering of the patients have reduced to a tremendous thing. And coming to telemedicine, yes, it has become a boon as and other thing I would like to add on, that telemedicine has also helped us in believing the symptoms or tackling with the toxicities of treatment when we tend to start the treatment. So we had a project when I was in Bangalore that there were some wearable devices. We tend to ask a patient, in case you have any fever, they can just document it on the app. And on top of that, if there is any tachycardia, the wearable device will be showing it that this is the value of heart rate you're having and probable a saturation. And if it is alarming below this will be alarming, and the reading can be informed to the concerned person, and they can advise the patient to be coming to the hospital or not, so that they get alert about the probable toxicities, and that can be taken care of early. So that is how telemedicine, wearables, and AI has become a boon, making them aware and also preventing the toxicities and the toxicities of the drugs.
Right. So, as you mentioned, wearable devices. So, specifically, would you like to elaborate on what kind of wearable devices they are, and basically inform viewers about how they could use it, and how it could be helpful for them?
So it when we started that project, it was basically a wearable device like a watch with the app on a mobile phone. So patients tend to have a smartphone and a probable smartwatch which can record what is happening post chemotherapy, the BP readings, probable BP readings, approximately the tachycardia, heart rates, is it going high or is it going too low, and then the saturation. So there are some variables which are mentioned, that beyond this, the link can be sent to the attending physician or a person concerned, so that the physician can be informed about this, and the patient will get a call so that they can come to the hospital and get evaluated as soon as possible. So this was the basic trial. But basically, it was a pilot project we had when I was in Bangalore.
Right. Thank you so much, Dr. Garg. So now coming to Dr. Pai.
Yes, am I audible?
Um, yes, yes. First
Yeah,
of all,
thank you.
welcome to the session.
Yeah, apologies for the connection issues. Tell me.
No issues. So basically, Dr. Garg had touched on artificial intelligence, given us a brief about it. So would you like to, dive deeper in, help us understand, the use of artificial intelligence, its potential throughout, the colorectal cancer process?
All right. So artificial intelligence has a role to play right from the screening process. So basically, you have computer-aided image detection of the polyps which is there in colon cancer. So you can actually have a physical colonoscopy or a virtual colonoscopy and use it to detect the early precursor lesions of colon cancer better. Whether that will actually have impact on survival or no, the jury is still out. But maybe smaller lesions or lesions which are very difficult to pick up at a very early stage, or a flat lesion which is very difficult to pick up on a routine colonoscopy, may be better picked up by AI-based tools or computer-aided detection. Secondly, as far as the treatment goes, AI has a role to play, especially in the development of newer molecules, because you are having a lot of AI-based tools which are actually producing 3D models based on the mutations or based on the amino acid sequences, and we can actually use it to assess the interaction of the various drugs which are available in our armamentarium in a particular patient. So it has a role to play in the personalized treatment of the patient also. Particularly, it may have a role to play in the future. Other than that, AI might have a role to play in the surgery part. So basically, you are having a lot of robotic surgery which is coming up, and robotic surgery precision movements which are not possible by the human hand may have the machine learning tools may play a role in better, more precise surgery, especially in areas which are difficult to sort of operate, like rectal cancer and other such areas, pelvic tumors. The other than that, if we talk about radiation oncology, AI-based tools are already being incorporated in various technologies like Varian, sort of the newest sort of thing which has come up in radiation oncology, which is actually in real time, it is assessing the shape, size of the tumor, which is changes sequentially. Once you give radiation to a particular tumor, especially in rectal cancer, day to day there will be some changes in the structure, shape of the tumor, and you can actually modulate your radiation accordingly to have a better outcome. And as far as the survivorship goes, the follow up goes, also definitely AI based tools can improve the assessment, patient related outcomes, pain outcomes, post surgery procedures also. So basically, role to play in screening, treatment, as well as survivorship.
Thank you, Dr. Pai. Now, my next question would be to Dr. Gupta.
Yes, ma'am.
Uh, yeah. So, Dr. Gupta, so we have been discussing about technology, about AI, about devices, etc., even telemedicine. So, what challenges do you see specifically in India for technology incorporation in specifically healthcare, in cancer treatment, in colorectal cancer? What challenges do you think? Are there or we might face or are currently facing to incorporate technology, be it from the side of the patient or as a practitioner?
The simple answer is the unfamiliarity or lack of knowledge how to use that, because this is the, even from the delivery partners, like whatever platform you take, they also usually take like hidden terms and conditions like things. They usually don't explain each and every aspect of the platform, how to use, what are the limitations. And because whenever you see from, because I'm not criticizing anyone, but from, if you see from beginning, that first of all the technology comes and one person deliver it to the common people, but at that same time he or she commit that it's like a Rajinikanth, that it can do anything. But where there is a written concept, that written terms and conditions, and these may create the problem, and there is no proper person from anybody that can guide how to use that technology. Usually the people come from these technology partners are usually not well trained also. They are trained for the marketing purpose only, that you can use this. Second come from the second entrance come from the doctor also, that they are already, you can see that they are not willing to even give the prescription in online, because they are handy in writing by by hands only the prescription, and they were trained with a in that time where was the technology was not there. So it is also very difficult for them to acquire technology. And yes, this is always time consuming, because if we are not trained, we are not even simply if we are not doctors are not good in typewriting. They are not fast typewriter. Usually if you go in big institutes or premier institute, they usually keep with them transcribers to write their prescriptions in digital mode, and they speak about that prescription. So they this is the again, limitation from doctor himself, because the doctors are not also trained in, usually these are the called engineering things, where they are usually they feel that if I learn this, better to understand or learn about the my field, and get the more expertization from the patient part. Even people, we are saying that the people are literate, literacy rate is increased in India, but the literacy means the people can write their name and can understand their name. I think this is the only meaning of the literacy. They are not well trained. And people in and also there is a remote areas are also there, where the reach of the technology is not there, and the technology persons also don't target these people easily. They usually go to the metro cities only, and the doctor himself is available in the metro cities or near to home. Then why will they go use the technology, and they can visit directly? And one more important thing is that yeah, usually whatever the patient says on the videos or on the online platform is difficult to estimate the uh, performance of the patient, how the patient is fit without seeing physically, because usually patient keep in sitting position, he can say everything, but whenever they visit your OPD, they seem different. And they are not able to explain the things on online platform also. So these are the hindrance from these from various levels, and the government is also in initial mode to only to publicize that this can be used. Although nowadays internet is cheaper on available on cheaper rates, and it is still not available all where. Whenever it comes to the 5G, then 5G is still not available properly in metros. Then it comes to the cities, and then if you go in the remote areas, 4G is also not properly working, and there are call drops or the network drops also. And the things comes on the latest network that doesn't reach to the Nova. And for these technologies, people should have the well equipped devices which are mean for these technologies. So it is also very not a, in the, not a everyone's cup of tea to purchase these devices. Even we can think that we are having this type of mobiles and etc. But all still this is only in 5% or 10% people who are having potential devices with their hands. So these are the main challenges which I mind that patient or in the use of technology in medical field at least.
Right. Thank you, Dr. Gupta. That is a very comprehensive and insightful answer. Thank you so much. So now my next question is to Dr. Garg. Um, so, since we have now discussed challenges as well, could you discuss some advantages as well as disadvantages of technology? Advantages not only in terms of, the yes, definitely for patient, for treatment, but also in terms of the number of patients or the number of diagnoses that can happen, like, now that the doctors can do if technology is incorporated, and then touching upon certain disadvantages of technology and around safety of the patients and so on.
So definitely this advantages, first of all, as you told, the diagnosis, patients can be picked up early. A number of patients can be screened at a moment of time. With the tools using AI algorithms, we can find out that these are the possible people who need a proper colonoscopy, if not a virtual colonoscopy, which is possibly available to evaluate. So and then the number of possible digital biopsies which can be evaluated in a shorter duration of time. So evaluation in the form of screening, then the biopsies, which where we might feel that these are the some doubtful areas, AI can quickly go through the algorithms and the database and find out that these are the possible uh, uh, diagnosis or the different kind of a biopsy lesion, and then the evaluation with the precision medicine in the form of some mutations or the genetic makeup of a patient. Are these mutations going to be genetically driven? Is the disease genetically driven, or these mutations can be transmitting to the other family members, like the progeny of the patient? So, are these germline mutations? So that can be easily picked up with the use of AI and the technology. So the only disadvantage I feel is sometimes, as of now, we don't know how much is the benefit. First of all, how much is the benefit of these screening? Is it going to give us an overall survival outcome? It is still doubtful. Second is the emotional attachment, or what you say, empathic relationship with the doctor goes away from these kind of observations. It is basically a machine learning and the machine talking. So that kind of thing keeps the patient on in a back foot to talk to a doctor or not to, or how detailedly we should be discussing with the doctor. So these are the two or three probable side effects or disadvantages I feel. But otherwise, yes, it is less time consuming and can give us quick result, and also can get rid of various confusing diagnosis which we can find out in our daily practice.
Thank you, Dr. Garg. So now my next question is to Dr. Pai. So we have discussed some advantages, disadvantages, some challenges. I would like you to take up the ethical considerations in incorporating technology for treatment and etc.
So ethical considerations, I think, especially are relevant in a country like India, where, like Dr. Tarachand also said very well, that it's very easy to watch a YouTube video or a cricket match, but that does not mean that you are knowing how to use a digital platform. So whatever you share on a app, or whatever data you put in, right from your address to your Aadhaar card or whatever it is for identification, and then the symptoms, signs, how you are doing, what drugs you are taking, what prescriptions you are getting, what brands you are using on the medicine, that has a potential sort of to be breached or to be hacked, irrespective of whatever platform you might be using, whatever encryption you might be doing. That is point number one. Secondly, the patient has to understand that some of the data which is being accumulated, may it be a radiological image or a colonoscopic data or a colonoscopic image or a pathological image, is it being used to help in machine learning? Because machine learning analyzes large data sets. After analyzing large data sets, only the machines can learn well and give a better sort of result. So for that large data set, informed decision making also should be left at the hands of the patient. Because if we are using data without telling them that it is being used to train machines, that is, I think, hampering with patient autonomy, because some patients may not prefer their data to be used, so as to speak. So these are the ethical considerations. The third is the data which we are using also should be balanced. So suppose you have a data set with 90% males and 10% females, then the machine will accordingly be relevant. The output of the machine after the machine has learned on that data set will be relevant on that inequality which has been present in the baseline data set. So it should be heterogeneous. It should be representative of all the sections of the society or the demography which we are looking at, because those biases which are built in the baseline data set will also reflect in the output after using AI or whatever it is. Lastly, very important is that when you are taking a treatment decision based on AI tools, it should be communicated to the patient, because in the end the doctor is responsible. You cannot blame that computer for giving you wrong information. In the end, the doctor is responsible for whatever treatment decisions are to be taken. So in case you are using AI tools, because what we are seeing here, there is a lot of lot of online tools also nowadays, lot of second opinions which are being taken online, and they are clearly using AI based tools. But whether the patients know that AI based tools are being used, or are the doctors sitting and discussing? So the art of oncology is not just data. It is about knowing what to do for a particular patient. It is about the nuances. Can a patient afford a particular treatment? So basically, ethical considerations should be there. You cannot just recommend an expensive treatment based on a AI based tools to someone who is not affording. Also, very importantly, you cannot just take the data. You have to tell that this data is being used in our hospital or in our software, and it might be helpful for the patients in the future. I'm sure people will agree, but it should be communicated. And in the end, the doctor is responsible for the decision, and you cannot wash your hands of the decision making process. I think that summarizes.
Thank you, Dr. Pai. Now, my next question is to Dr. Gupta. So, since this session focuses is based on patient-centric approach, I would like to ask, how do you think your opinion basically on how feedback, basically patient feedback, in terms of experiences or using a technology and so on, can be incorporated for better treatment or awareness and so on?
Yeah, it will be too early to speak upon this, that the how technology will work. As I mentioned earlier, that patient can send or patient can upload their reports only. Patient can write the symptoms only. But again, but the ultimate thing which is deciding factor is the patient's is a general condition, how to discuss the finances with the patient, because the patient finances also plays a role, which can be explained on because if you give something in writing that this will be the cost and this will be the result, then it is difficult for the patient to understand till the patient faces a doctor and discuss all the aspects that because if you give in writing, then it is always written already on the Google and etc. where that after that patient also move to doctor to understand what actual benefit will be there. There is a one-to-one discussion, so it will be too early to speak upon. Yes, there were like some institutes like TMH through the Nabya platform is giving online opinion also. But these opinion, whenever you will see, there are three, four options are provided to the patient that you can go ahead with this treatment, and these tests can be suggested. But patient, the one missing part is the patient counseling. Whenever you are talking about the cancer, it is the financial, emotional, social burden to the family of the patient, and for that patient need, because cancer is not a disease that news can be released directly that you are having a stage 4 cancer, you are having this cancer. So patient needs counseling part. For that there are specific session, or I don't think that patient can be satisfied on only on digital platforms, because sometimes there are 3 4 members, 5 members usually come together in chamber, and that is not possible on a digital platform to interact each and every relative of the patient separately, because it will become time consuming. But whenever these people come in the OPD, they usually summarizes their questions or their what are their concern about the patient, and that can be discussed. And also at the same time point, we can assess the patient's general condition, patient's mental status also. So it will be too early that we can treat the patient on basis of digital platform. Yes, some outline can be made only, that these are the possibilities, and I think this will be like a Google system, that patient can go directly any international guideline, and then he can go, yes, these are the treatment options are there. But I don't think that it is now a time to go in a digital platform. And I earlier mentioned in my last reply also that patients are also not well educated how to explain their symptom also. Sometimes they don't know that what the symptoms they are facing. Even we just dig out that what the symptoms may be there, and then they tell about their general condition. And at the same time, in the OPD, we usually take that yes, psycho-oncology counseling must be there. If the patient is weak, the dietitian counseling is also there. So it will be very difficult to bring all the uh, uh, concerned departments on a same platform to discuss with the one patient, because usually a cancer, it cannot be treated by the single person only, either medical oncologist, surgical oncologist, or radiation oncologist. This always demands a multidisciplinary team, which may need a dietitian, which needs psycho counselor, also physiotherapist and radiologist, uh, who is just confirm the findings of the CT scan which is already present, nuclear medicine specialist, medical oncologist, radiation oncologist, surgical oncologist, and so on. There are so many departments are needed to treat a single patient of the cancer.
Right. Thank you, Dr. Gupta. My next question is to Dr. Garg. So, as we have been discussing the initiatives government has also taken, we touched upon that also, and you mentioned the device, and you mentioned in your first answer about the European companies and countries, and the difference in percentages of how much technology is used there and less here, etc. So would you like to tell us what, according to you, could India, or maybe some collaborative efforts that are required to improve the use of technology, incorporate it in a better way to reach more people, make treatments and diagnosis more accessible?
So definitely, government has tried some way outs to make the technology more easily accessible. Only thing is the government making the people aware that this is how to use it, this is how do we use it, that this is how we input the answers or the details, and are these details mentioned which are reliable? So these are the probable questions. And as Dr. Tarachand also has said the same thing, so relying upon only those things may not be of help. Making them aware that this is how we use the technology, this is how we have to explain it, and in case the things go haywire, the probably we might not get a probable answer to that. So if a patient is not well and he puts out that these are his probable vitals and send it to the doctor will say these vitals are perfectly fine, and the condition of the patient might still not be better. So we cannot just rely on the technology as of now. It is way too early for us to decide. But yes, this is what we also learned from the pilot project which we took, that relying upon on the only on the values what the variables are giving is not possible. The patients have been informed, and sometimes the variable can also give us a false reading, and maybe that is a false alarm. So these things, I believe, until unless we have a well-educated, well-trained people who can explain each and everything to the patient, and patients' understanding about those things are so much so executive, they understand it so well. So then only we can use these kind of technologies. So as of now, what I believe is our patients, they when once they understand about the disease, they're scared, and after that they just have a complete mental breakdown. So sometimes they don't tend to understand what a doctor is telling after that. So first of all, that emotional, psychological, social, those supports are important, and initially those things are required. And if you tell that a patient on the first day that this is a variable or this is a technology what we are going to use and help you out, it might not be help the patient, and the patient may not even turn back to the hospital after listening to all those things. So this is what I believe, it is too early, as both of my colleagues have mentioned.
Thank you, Dr. Garg. So now I request every doctor to mention either a closing remark, a personal experience, or anything they wish to share with our audience, so that they use, if they are using technology, they use it properly, or in general for spreading colorectal cancer awareness. Any remark or any experience that they'd like to share with our viewers. So I'd like to start with Dr. Pai.
So, see, personal experience, no, but just a few points. I think the role of AI or machine learning as of now in cancers in general, maybe colorectal cancer also, is mainly as of now for screening and maybe diagnosis, radiology and pathology. I think these are the aspects in which there is major role. I think personalized treatment and all these and follow-ups and all these other things may come later, because in that you are actually treating the patient. But radiology, for example, and pathology does have like visual fatigue. You see those images again and again, and maybe machine learning or AI-based tools can help in the making proper diagnosis. And also in screening, maybe for example, virtual colonoscopy, etc. The second point is, in India, utilizing technology is difficult. I think that point is absolutely well taken. But the thing is, suppose you use an app like Dr. Garg was also saying, in which the patient is sending some vitals or whatever, but that does not mean that you don't call the patient to the hospital. I think we have to follow standard practices, and along with that, collect data and compare and contrast that actually how many of them were actual, like sort of true positives, rather than not collect data at all. I think that is something which we have to look at, because that is the way we will evolve, that is the way we will refine our practice. The third thing is, doctors, I think, are sort of some specialties, or maybe all the doctors are sort of having an inferiority complex regarding AI and machine learning. And there is a tendency to sort of write them off, but I think they are the future and they will be helping us, not replacing us probably. Right? And I think that is all I want to say.
Thank you, Dr. Pai. Like, just out of my own curiosity, would you like to elaborate more on the third point? Like, how do you think it might be more acceptable to doctors? Do you think, how to make it more acceptable? Do you think there should be a way, or so on?
So, quite frankly, the way to make it acceptable to doctors is, quite frankly, we will have to, like, we are students throughout our life, so we'll have to learn about this also, because of the simple reason, many a times there is a sensation that the machine is taking all the decisions and we are being sort of put on the back burner. What about the other things? What about the personal connect with the patient? And that will remain. But the point is, we can use data science and we can use tools to help our patient better. For example, if we have a breast cancer patient and she undergoes surgery, a medical history is taken and you recommend that daily half an hour chalna hai, but you have forgotten that 1 year back she has undergone bilateral knee replacement. वो data एक red flag आ सकता है before giving your lifestyle advice कि बाबा इनके लिए वो appropriate lifestyle advice नहीं है. That is not an appropriate lifestyle advice for this particular patient, because you are not concerned about her knee replacement. You are concerned, you are having tunnel vision, you are only concentrating on breast cancer. Similar, and this is a very simple example, this does not require a big, and that this actually will establish a better patient connect, because the patient will feel that the doctor is remembering everything about me, not just my cancer. So similarly, it can help radiologists. For example, certain red flags which are there, certain image interpretation, they, after a person has seen 20 radiographs, 20 MRIs, obviously there is certain things which might get missed. AI can help us raise a red flag, and actually your reporting will improve, because you will go back and check what have you missed. So similarly, I think it is an asset. It is not something which, and it is, we can work together with AI rather than AI replacing doctors. That is what I feel.
Thank you, Dr. Pai. That was really insightful, actually. That was a very fresh perspective, I feel. Thank you so much. So now, coming to Dr. Gupta.
Yes, ma'am. For AI, I have not used AI until now, but yes, I have given some advice on online platform or only on video calls or online. So I would suggest my patients that if you are consulting online or on AI platform, that you must be clear before that if you that there are should be limited people with you to ask the question with the doctor, because if you are there with all the relatives, then it will mug up all the things, because there will be a repetition of question. Like sometimes the people ask, we say that, yeah, what can be taken in the food? So we say, yes, you can take each and everything, but that should be hygienic only. But there is no limitation of food, there is no restriction, no need to boil the salad and etc. But you can take each and everything except the bad addictions. Now the question will come that patient can come take chapati. So another will ask the patient can take this juice. So this type of the questions will usually get usually waste your time only, because the every time on the these platforms time is very limited, and you are allotted for a limited time only. And another thing is that you should have a checklist, or you should you can even can write down on your paper or anywhere that what questions do you have in your mind, because I think that a doctor will answer your hundreds of the question within 5 minutes only, because we know that how because you we know that you have counted one divided one question in 10 questions only. So it is very easy for us also that we can answer each and every question, and it is easier for you also that you can get all the answer of the all your the question in your mind. Third thing, you should be honest whenever you are talking to a doctor on digital platforms, that the what the patient usually have the history in the symptoms. Sometimes the patient usually tell us that the patient is having generally weakness and patient is not getting up, and whatever we find that patient is having no BP and no pulse, then patient is in hypertension shock and need ICU admission. It has happened many times on phone calls. Whenever we ask somebody that please take the BP and pay, we found that patient was not sleeping, patient was unconscious at that time point. These things are happening whenever we call patient should be honest that the how much if we are sometimes patients tell us that patient has a very high motivational level, so you can prescribe any drug, but we have to consider that the what is the age. So there should be in a realistic grounds only, that whatever the patient is having symptoms, whatever the patient's performance status there, that patient what activities can be done at home by the patient. So that decide then the what treatment should be offered to the patient. And even they should have a crisp and clear that how sometimes they, if they are taking diabetic medicine and diabetes is in under control, they don't mention in their history that the patient is having diabetes, because they consider the diabetes is controlled. So they should mention each and everything that patient is having these disease, these treatments are being taken by the patient at present, and what is the family history. As we have discussed that the family history is also important. How many people in the family are affected, and what is the which type of the cancer. So if the patients are honest at their part and they are clear, then they get the better answer for their questions.
Thank you, Dr. Gupta. That was a very informative answer, and thank you for sharing your own personal experiences. Thank you. So, now coming to Dr. Garg.
Yes. So I would say it is too early for us to be incorporating AI and technology, but definitely we should not be looking back at AI and thinking that it is going to replace us or something else. It is going to help us a lot in making our patients comfortable, diagnosing the disease early, though it is too early for it to be becoming a part of treatment. And also it once the things these, as I told you about a pilot study which we did, so there these are the learning things which we take out from the AI platforms or the information technology, that this is what we can use and slowly incorporate in our daily practice so that we can help a patient. And definitely our patients are going to be helped with these kind of things. So doctors are, I believe, not to be scared. We should be welcoming AI in a medical field with open hands, so that we can help each one of our patients and also learn new things, because AI, with the analytics, with the algorithms, we are going to learn a lot about what is happening in the diseases, understanding the biology. So not only the biochemical or the biological nature. So now we are going down to the proteomics and the genomic levels. So those levels where the diseases are starting from, what is happening with the gene, what could be a probable driver. So there we can find out certain answers that why this patient has this kind of a disease. So most common answer we listen to a patient asking is, the patient has not been having any bad habits. Why this cancer has happened? So it, as of now, we say it is multifactorial. So there are certain many other causes which are there. So then we can still, we might not be able to point out, but yes, we can still find out that these are the probable genes which are getting implicated in transformation of a normal cell into a cancer cell in this particular gene pertaining to the colorectal also. So this is what I believe, and definitely some information is a bad information. If there is a doubt, please clarify it with your doctor. Don't jump on to that these are the only things, and these are the only things which we should be thinking about. There are a lot number of things which can be involved, and the diagnosis can vary. So it is not the malignancy with a single symptom, it can be something else also. So jumping on to reading on it on Google or Yahoo that this is the probable thing, this is the symptom, and this is the thing, it is not always black and white. So in oncology or in any medical field, we feel that there are shades of gray. So we have to learn all the things and evaluate each and everything, not jumping on something which is extremely rare.
Right. Thank you, Dr. Garg. Now, with this, we would like to conclude our session for the day. So, thank you so much, all the panelists, for this interesting and engaging session. And thanks for joining us. Thank you for your time. I'd also like to thank our viewers and stay tuned for our next session of the series. Have a good day, everyone.
Thank you. Good night.
Thank you.